you're probably gonna you're probably gonna see me go back and forth a little bit tonight. I'm trying to record on another medium, something we're trying new, just like this is new. This is our new weekly form, Ask Dr. Darwin, and I'm going to be here on a weekly basis to ask questions. Or we're going to try to be here on a weekly basis. All depends on your questions and the week, and it may also depend on your availability and basically the questions that you may have. Okay, so every Thursday, every Thursday, we're going to be coming live here on Facebook and then also here on YouTube. And we will be here to answer questions. Questions about your dental health, questions about your profession. If you're a new dentist, about your profession, things that you are interested in as far as life after dental school, life after residency. And that's what this forum is here. There's also this forum is here pretty much and basically to help you. All right. Hey, student Dr. Guzman, how you doing? My man Kurt Wilder, how you doing, man? Good to see you both. Kurt, how the twins doing down there, man? Missed you guys down at the Hinman in Atlanta last March. Hope to see you. Maybe see you and Sonia, and also see the twins, man. But I hope everything is doing good. Dr. Biggs is in the house. How you doing, Dr. Biggs? Good to see you. How you been? Like that photo you had today. Someone had a nice little profile shot of you that I saw on Facebook. Looking good. Hope all is well. So again, we're here every Thursday, or at least we're going to try to be here every Thursday, depending on the demand. And it's for new dentists, like student Dr. Guzman, and also it's just like it's also for consumers. We'll have some other dentists on that'll be able to maybe answer some questions that you all may have, and some specialists. We've got a couple colleagues that come on sometimes. Dr. Rico Short out of Atlanta, GA, is a board certified endodontist. He usually comes on from time to time and ask some questions that the new dentists have about endo cases and when to refer and types of rotary systems to use. So, hey, again, we just put this together and I tap into my network, my power base, to bring this information for you guys. All right. My goal and my purpose is to help as many new dentists as possible. And also the purpose is to also help you as a dental consumer. Many of you have untreated conditions in your mouth that you, for whatever reasons, just have not gotten done. Or you have some conditions in your mouth that you don't even know about that have gone undetected. And you got to remember, just because it doesn't hurt doesn't mean that there's not a problem. All right. High blood pressure sometimes does not hurt. You know, having polyps in your sinuses may not necessarily hurt, but doesn't mean that it's not a deadly condition or a problem or something that can cause into a problem. So, hey, we're here to help you all with some procedures, some questions about some procedures, whether it be implants, teeth whitening, veneers, smile makeovers, dental pain. All right. You also may have some questions about oral health care for your family or your friends, or namely your kids. We have a couple pediatric dentists that come on sometime and share their knowledge also about oral health and what age to take the kids to see the pediatric dentist. Mark McPherson, how you doing, man? Good to see you, man. It's been a while. I keep missing you when we come back and forth to LA. I saw your little guy on Facebook. He's getting big, man. Getting big. Wonder who's going to win that UVA Virginia Tech rivalry game this year. We'll see. I think you guys play us at our place this year. So, but good to see you, man. Tell Kim I said hello too. Dr. Johnson, Dr. Anthony G. Johnson, pediatric dentist. extraordinaire. He's one of our pediatric dentists that comes on from time to time to answer some questions that the new dentists have. How you doing, Dr. Johnson? Good to see you, man. For those of you that are watching too, hey, show us some love. There's some icons on the bottom down there. Thumbs up, hearts, smiley faces. Hey, the more that you hit those, the more recognition we get for the series. And Facebook has some old crazy logarithm, or I don't know, some kind of arithmetic they use with regards to those emoticons. So feel free to, if you hear something that you like, or you're just happy to see my face, or you're just happy to be alive, surviving on one day past hump day. This may be the fourth or fifth day of the week for you. You're just happy to be alive while you're on listening. Just push. So good. So, hey, we do have on this forum, we asked people to submit questions and or comments to my email address, which is newdentistcoach@gmail, newdentistcoach@gmail. And actually tonight we did get a question from one of the dental students at Rutgers. I'm going to read his question and kind of answer that tonight, and then we'll continue to answer some more questions afterwards. Dr. Emily, how you doing? What's going on? Good to see you. So glad that you're joining in. This is a forum that we do. Actually, this is the first episode of this fall called hashtag Ask Dr. Darwin, where we ask questions. Well, we answer questions that have been asked, submitted via here live on Facebook or via my email address, newdentistcoach@gmail, newdentistcoach@gmail. So we're on two mediums tonight. We're on Facebook, and we're also over here on YouTube. Hey, if you guys ever want to hear some more information, this is for the new dentist, more information about dental residency, some tips, some strategies, please go to my YouTube page, which is Dr. Darwin Speaks YouTube channel. Subscribe, and we've got a lot of content that's been posted, and we're constantly adding new stuff, both inspirational things and also some tips and strategies and things like that. So feel free to go there too. So what we were going to do is I'm going to dive into one of the questions for tonight. Hey, Chet Turner, what's up, money? Good to see you, man. Billy Kemp, VA in the house. How you doing, man? We're going to answer one of the questions that we have from one of the dental students at Rutgers Dental School, and he's the president of one of the student chapters. And we're going to read his question, and this is pretty much going to pertain more to the new dentist than it will to you all that are watching that are dental consumers. And we'll go to some of your questions too afterwards. So the first question that he has is actually it's a two-part question, and his question from student Dr. Israel from Rutgers is, what's one of the largest or the biggest challenge you've come up against in your progression from residency to practice? Again, what's one of the largest or the biggest challenges you've come up against in your progression from residency to practice? And then the second part of it is, what tips could you give us to avoid or handle that challenge? All right, so I'm going to read the question one more time from student Dr. Israel from Rutgers. What's one of the largest or biggest challenges you come up against in your progression from residency to practice? So let's answer that one. So I graduated out of dental school in 1998. So we're close to oh wow, almost 20 years now. I used to be an architect before that, worked in the field for a while before going back to school and getting into dentistry. So we're talking about 20 years ago. So my progression from residency to practice, one of the biggest challenges was, believe it or not, confidence. Having confidence in your abilities, having confidence in just being able to do certain procedures. Okay. Hey, Dr. Duncan, how you doing? Good to see you. I'm going to be meeting with Dr. Newsom tomorrow. So I'll be sure to tell her that I mentioned that we know you, that we know each other. But we're talking about what's one of the biggest challenges that I've come up against in my progression from residency to practice. And one of the things I said was confidence. Confidence. I mean, granted, you go to dental school for 4 years, you learn a lot of different, procedures, and that's great. But there's still some procedures you still may not feel as comfortable with. So what do? Well, you do a residency. All right, general practice residency that's either hospital based, or you may end up doing one that's school based, an AEGD. Even from that transition from residency, you'll have a lot more procedures, that you're more comfortable with, and your confidence level probably goes from like here to here. All right, but there's still some stuff that you just haven't done enough of coming out of dental school and coming out of residency. So that's one of the biggest challenges. All right. Another challenge is basically not knowing the business side, of dentistry. And that can be crippling, but also it can be fun in the sense that you've got a great opportunity to really just dive in and learn so much about the profession. So those are the two things that were two of my biggest challenges when I progressed from residency into private practice. The second part of student Dr. Israel's question is, what tips would you give us to handle or avoid those challenges? What tips? And I think we might be frozen over here on Facebook. I'm not sure. I'm trying to figure out here. Hold on. Give me a second here just to check something. It says we got a weak signal, but we're going to keep moving here. Let's see if this comes through for myself here. Test. Yep. All right. So we're going to continue. So the second part of the question is, what tips would you give us to avoid or handle the challenge? The challenge that I mentioned was confidence and not knowing the business side of dentistry when you make that transition from residency to practice. So what are the tips to help you handle that challenge? First tip is make your mistakes fast. Make them fast. Sounds crazy, right? But you want to make as many mistakes as possible right now, so that you have the rest of your career when you're learning to be able to be more proficient. All right? So it's all about time and timing. You're going to maximize your time by being able to learn from your mistakes early. All right? So make those mistakes fast. Make them early in your career, or make them early in your training. All right? Doing a residency is a great opportunity to be able to figure out what you don't know. Be able to know what you don't know. And then what you're able to do is sometimes you're going to make some mistakes. The only mistakes because you just don't know everything. No one knows anything. So one of the first tips I would give you on that challenge as far as confidence and not knowing the business side is, make your mistakes fast. Make them fast. All right. Second tip I would give you to be able to handle some challenges is it's in alignment with the mistakes. Actually, you want to be able to manage your mistakes. That's the second thing. Second tip: manage your mistakes. So what do you mean? What do you mean, Doc? What do you mean by manage your mistakes? Meaning, take some CE courses on areas that you're still wanting to learn a lot more about. Take those CE courses. All right. So now you're learning more on certain techniques, certain procedures, which will allow you to be able to manage your performance. So CE, take more CE. That's the thing that we want you to do. That's one way of being able to manage those mistakes. All right. Let's see what else we got here. Manage your mistakes. Another thing that how you can manage your mistakes is being involved with and being coached by a mentor, right? A mentor. Now, everybody can't be a mentor to you. All right, you want to find someone that actually wants to engage with you and actually help you, and is hands-on with you. All right. You also want to look for a mentor, or a person, or a coach who's already gone or been where you're trying to get to. All right, so that's key. All right, you want, and again, like I said, you want somebody who's going to be hands-on with you too. Very, very important. Hands-on, hands-on. So that's important also. Okay. So you manage your mistakes by getting a mentor and a coach that can help you through it, but you also manage your mistakes via CE, continuing education, both on the business side and the clinical side of dentistry. Clinical side is great, but the business side is just as important. My rule is this: for every three classes of clinical CE that you take, you want to be taking at least one business course or class, practice management, risk management, etc. Okay, and then the other tip that I would give you, or that I want to share with you with regards to how to avoid or handle some of the challenges, is you've got to learn the clinical. I'm sorry, you got to learn the business side of clinical dentistry. There's no ifs, ands, or way about it. You can want to be able to place implants and do cosmetic dentistry all day long. You can be real proficient at it, right? Go to all these different institutes and find out how they do it. You can have all of that, but it doesn't mean anything if you don't know how the business side of it works. All right? Before the clinical side even starts, the business side is at the forefront. All right? How do patients find out about you? How do you get patients from the phone to make an appointment to coming in to the office? How do you treat them when they're in the office? There's a series that I have based on a consultant that I used to use for one of my practices. It's the 24 steps to patient success. 24 steps to patient success, where it takes you through step 1 all the way through step 24, from the patient, the time the patient's engaged, either via your website, telephone call, all the way through the many steps that they go through the office, to the time where the treatment is totally completed and they are referring patients to you, and then you're following up on them. There's a 24-step process that's based on practice management, based on marketing, okay, based on the business side of running a dental practice. All right. So those are the 3 tips. Make your mistakes fast. Make them early and fast. Second tip is manage your mistakes. You manage your mistakes by getting a mentor, finding a coach and a mentor, and then also doing continuing education courses, both clinically on the business side. My rule is, for every 3 clinical classes you're taking in CE, you want to be taking at least 1 business class. And then the third tip to how to manage and handle challenges of confidence is you got to figure out learning the business side of clinical dentistry. There's lots of different CEs out there. The Pride Institute. I mean, there's so many I can't even name, but you need to subscribe to this one magazine that I recommend. Is Dental Economics. Dental Economics is probably, like, for me, it's like when I was coming out of residency. It was like the Bible of business, the business of dentistry. Lots of different articles. They had some continuing education articles for the business side. I'm sorry, for the clinical side, but there also were a lot of articles on practice management, risk management, insurances, codes to use for different procedures, all those different things. So if you haven't, student Dr. Israel, if you haven't gotten or not subscribed to Dental Economics, you got to get on. It's free. You can Google it. Just put in Dental Economics, Google it, and they have a free subscription where you can get a magazine, or you can actually a print magazine, or you can get it online. It'll come up like an ebook or an e-subscription. So I hope that's answered your question, student Dr. Michael Israel from Rutgers. Thanks again for your questions. Every week, every Thursday, 7:30. If you have questions and you can't come to this live session, send them to me. Send them to me at newdentistcoach@gmail.com. Newdentistcoach@gmail.com. I want to hear your questions. I want to help you. I want to give you some information, whether you're a new dentist, dental student that is in dental school, get ready to transition out of school, or if you may be a pre-dental student. I've got a couple of students in undergrad that just started to mentor that are freshmen, first year in college, and they know already, hey, Dr. Hayes, I want to be a dentist. How do I get started in undergrad? So when I say new dentist, I mean undergrad through dental student to resident to now you're a graduate of either a residency program or a dental school, and you're out practicing. New dentist is anyone that's been practicing anywhere from less than 5 to 10 years. So I'm here to help you. This is my passion. This is my purpose. I've had some great mentors and some coaches along the way, and I still interact with them on different phases of my career too. So that's my purpose here to help you all. All right. So if you have those questions, newdentistcoach@gmail.com, newdentistcoach@gmail.com. Also on this segment of Ask Dr. Darwin, we are also here for those dental consumers, all right, those patients, those customers that have teeth, or even those that don't have teeth too, right? We're here for them also. And so if they have questions about the oral health care, whether it be implants or extractions, pains or emergencies or something that some other past treatment that they've had done, wisdom tooth problems, braces, different types of non-traditional braces that are on the market that have gotten some real good results. Whitening. You wonder how I keep them so white, right? Whitening, if you have questions about whitening, so even just a smile makeover. Again, I have some colleagues that are specialists in certain areas that sometimes come on these calls. If you have some questions and if you can send them to me early, we'll try to see if we can get some of those people, some of those specialists to come on to answer some questions and give you some more information about some procedures that you're interested in getting done for yourself. So again, we're here for that too. So it's about looks like we're about close to getting end of our time. We had some problems with the Facebook Live here. I'm not sure how much of this recording got recorded, but we will post this here on YouTube. So those of you watching here, you get a chance to see the full recording on my YouTube channel. Again, I have a whole bunch of content, pretty much more for new dentists, and that's our YouTube channel, which is Dr. Darwin Speaks. You can also check my website, DrDarwinspeaks.com, and we've got a lot of new content that's being uploaded each and every day. A couple blogs. We have some events. If you also want me to come out and maybe speak to your group, whether it's a new dentist group, undergrad dental school, or pre-dental school, hey, I'm here to help. Just send those emails for those requests to newdentistcoach@gmail.com, newdentistcoach@gmail.com. So look, guys, that's my time for tonight. I hope this has been helpful. I'm here for you anytime. Just shoot me an email. You can also follow me on Twitter and Instagram at Smile Dr. Darwin. Smile Dr. Darwin, Instagram and Twitter. And I hope you guys have a great rest of the week. Remember, every Thursday, 7:30, Ask Dr. Darwin. It's a Q&A form and question. I'm sorry, a Q&A form and session for you as the customer and also for you as the new dentist. Again, I'm here to help you as best as I can. And my purpose is to help as many new dentists and customers as I can with their oral health and their dental professional development. Guys, take care. Have a great rest of the week. See ya next time. Peace.